of the heart on the left side. Look, and you feel pain when the patient feel pain, and tell you, high. And the other position, and at last on the spine and normal. After we finish with the shoulder, with the neck, and with the face too, completely. And okay. After this, we have the map. Okay, the map is reported on this paper map or digital map. The point that we found with this assessment, manual assessment, no MRI, no X-ray, manual, only this. And after this, that we have this pain map, we can treat the patient. Okay, with what? With MAM device. MAM device is a muscular acoustic modulator, autonomous. Is a device that produces a special impulse characterized by the simultaneous modulation of both frequency and power of focused acoustic wave. Same time, frequency and power. With a variable frequency from 0 to 550 Hz and the acoustic pressure up to 3-4 bar. We have a pedal, we have also a probe to treat the patient. The hypothesis on which we use this treatment is that the cause of the pain is a electric silence blockage of the spine, neuromuscular spine, mechanical sector of the muscles. For this, we use this particular impulse, MAM impulse. We can treat any type of pain if it reduces or disappears after the first session. Doesn't matter what is the diagnosis, the level. We treat all after the assessment, manual assessment, after the pain and map. With this probe, we can treat all the muscles of the body, all the diaphragm, all, no problem. On the face, nothing. After this, we have this map, okay. The first MAM session is a true tentative test for treatment efficacy. The first. Normally other treatment is enough for this. We can treat patients from children to centenary. Okay, pain is a muscle for us that skin is suffering. Memory leaves immediate pain. We recently studied with SW, Loretta, EEG, effect on the brain before and after MAM treatment of a painful point in contraction, pain. Look, in yellow, this is the area of the brain where there is not correct functional connectivity. After the treatment of only one treatment, with MAM and ACOMAM, look, the color change completely, is normal. It's white or green. Lymph nodes, now you go to lymph node system. Not lymphatic node, but lymph nodes. Okay, lymphatic system was first by Paolo Mascagni, studied in Italy in the 1786, 7. the lymph node is a lymphatic pump. We suppose that the lymphatic node is the most important pump of the lymphatic system. Note that we have about 700 lymph nodes in the body and 300 in our neck, head. This is the problem. Hindered discharge of lymphatic system. Our theory postulated that the presence of an hindered lymphatic drainage of our tissue or organ is the pathogenic basis for their disease. If that's what the drainage of lymph, we have pathology, disease. Why lymph drainage become hindered? Our hypothesis, lymph node congestion, lymph node, not lymph node. Because normally very close to bacterial infection, fungal infection, viral infection, allergic reaction, stress. Okay? Once the infection is resolved, if the lymph nodes do not return to normal volume and function, for us, the tissue that they drain cannot recover its physiological function. This is the problem. What we do now? We propose to decongest and activate the lymph node function using a targeted vibration stimulation or by the MAM impulse, applied exclusively to lymph node station, only on lymph node station. This is the Drenomab. In 2011, this device, with the addition of caps, start to do this protocol of massage. It is a massage that uses MAM impulse modulation every 10 seconds for 10 minutes. Okay, back, like you see there, in front, and here, and which are the clinical indications? Look, the last one is the most important for us. Body water retention, yes, is first one. Tiredness, short legs swollen, heavy, achondrosis, cool feet, restless limbs. Okay, but for us, important is ataxia, sclerosis, that we find reasons. After the first session, there is a reduction of disappearance of tiredness, weight, and pain. After 4 sessions, there is a reduction in the volume of the limbs. After 10 sessions, there is disappearance or reduction of the cold, burn sensation. What is this? Agma treatment. It's a manual message with the MAM device probe and other kinds of probe, okay? And the massage sequence is always the same. Look, this is the protocol. On the face, on the neck, and on the head. Okay, on the right, on the left. It lasts 20 minutes. The standard session is 1 time a week or until 6 every day. It's very important. Which are the indications? Multiple sclerosis, headache, narcolepsy, normal pressure hydrocephalus, coronary, sequelae or septal stroke, semi-dementia like Alzheimer's, NF syndrome, autism, long COVID and post-COVID, alternating hemiplegia syndrome. We recently started to study with perfusion MRI and IUD effect on the brain before and after this simple massage, Alma massage, treatment of patients with MS. Look, level evaluation. Before and after, we can look that the perfusion is completely different after 20 minutes. One cycle, one treatment with Akuma, completely changed. And here, this is for congestion Prof, this is the result. Look at the brain. There is an aggregated connectivity functional in this area, yellow, red, look, a lot. After 20 minutes, change it all. Only rest a quarter part of this. Okay. And this is another case with a mess, This light blue area that we look on the right is before treatment. This is a function connecting the alteration chronic. This is for this, the color is that blue. But after the treatment disappears, completely disappears, 20 minutes. This is what we starting to study with to measure what happens when you use this treatment, treatment in these patients. What is the effect of this treatment? We must speak about lymphatic system. We know that lymphatic system draining our brain from 1914 in states crashing with the anatomists. They write this. There is, we forgot. In 2012, the term lymphatic was coined first time by Leaf. In 2015, Louveau, using 2-photon intrathecal electron microscopy, highlighted the lymphatic system and meningeal lymphatics. He looked the lymphatic in the brain. Recent, this is very important because it's only a Nordic study with an MRI, intrathecal gadobular contrast. They put in the liver the contrast gadobular only in this history. This treatment shows the drainage of this system and the cerebrospinal fluid into the head and the neck, lymph nodes, in the lymph nodes. They show us this. Recently, MRI, PTI was developed with this particular ARPS index that can measure what? The lymphatic drainage. We can measure the lymphatic drainage. This is the system to measure what happens when we treat these patients. The lymphatic system has a lot of functions. Exchange between cerebrospinal fluid and intestinal fluid, but it cleans brain tissue, removes soluble proteins. It contributes to brain fluid homeostasis and is implicated in communication between the brain and the immune system. This is a schema, picture, and not easy to understand, but a very, very complete of this lymphatic system. But what happens for the proteins? We know they are amyloid, beta amyloid, tau, alpha-synuclein, that we know there are not in more pathology like Parkinson and Alzheimer's and MS. Okay, about this is the completely different point of view. We hypothesize that restoring the physiological drainage of nervous tissue, it could decrease the immune attack. We have the immune attacks, we know, all to our brain. Our brain has this, how to block this. The problem, perhaps, is the misfolded proteins. And other proteins that we don't know at the moment, that stimulate this immune attack. With this protocol, now I give you a video.
The Mount Fluid Dynamics Protocol. In 1869, the neurologist Jean-Martin Charcot held the first lecture on plaque sclerosis at the Salpêtrière Hospital in Paris. The plaque sclerosis is a disease that causes the formation of sclerotic plaques within the brain and the degeneration of the myelin coating of nerve fibers. Today, it is called multiple sclerosis. Charcot was the first to identify the triad of disorders that characterize the plaque sclerosis: diplopia, disorders related to vision; ataxia, disorders related to balance and motor coordination; dysarthria, disorders related to speech. Multiple sclerosis is a progressive disease currently incurable. In 2008, the vascular surgeon Paolo Zamboni observed that in patients with multiple sclerosis, the veins that drain blood from the brain and spinal cord are often clogged, and therefore he proposes to dilating them venous angioplasty to free their flow, which had good clinical results, but unfortunately were no longer lasting results. The cephalospinal fluid, also called CSF, surrounds the brain and spinal cord, protects them from traumas, nourishes them, and enables their proper functioning by draining the waste substances produced by their cells. In 2012, the vascular surgeon Mandolesi is convinced that the liquid CSF from the brain and spinal cord, in addition to draining into the veins, also has a second lymphatic drainage system, which drains it into the lymph nodes of the head and neck. He hypothesizes that this second system may present in some individuals a hindered discharge at the level of the lymph nodes, and therefore employs the massage apparatus to decongest them. In 2012, Sandro Mandolesi began treating the pelvic and leg lymph nodes of patients affected by multiple sclerosis by the acoustic muscular modulator MAM, with remarkable outcomes on walking disorders. Dragon-MAM protocol. In 2014, he developed the protocol for head and neck lymph node decongestion, ACO-MAM, with additional results on chronic fatigue, memory, sleepiness, and improvement in the subject's quality of life. Until a few years ago, the liquid CSF was thought to be drained out of the scalp only by veins of the neck and chest. This knowledge motivated Zamboni's hemodynamic treatment, venous angioplasty. In 2015, Antoine Nouveau published for the first time the scientific demonstration that the brain and spinal cord used not only the already known pathway of the veins for the CSF drainage, but also that of the meningeal lymphatics and the lymphatic system that drain it into the lymph nodes of the head and neck. In 2022, Sandro Mandolesi developed the ambulatory fluidodynamic protocol with the MAM device in order to improve CSF and spinal cord drainage. The MAM fluid dynamics protocol is the union of ACO-MAM and Drano-MAM treatments. It is an intensive and non-invasive treatment for outpatients. It consists of one daily session of ACO-MAM and Drano-MAM 5 times a week for 2 weeks. Early results on the symptoms of patients with progressive stage multiple sclerosis have been remarkably positive. Drainamam is a massage with vibrating cups that begins in the prone position for 10 minutes, followed by another 20 minutes in the supine position. Akumam is a massage performed according to a specific sequence on the lymph node stations of the neck and head.
Now we speak of our results with this method. Why speak of first miracle? Because this was a very miracle. When we know this patient, he was 8 years that he required help with the aspect of daily living. 8 years. Complete paralysis of lower limbs from 5 years. Bedridden all day in the last 5 years. And the coordination of the upper limbs from 3 years. In October 2022, after only 28 month treatment session, only 28, he started to move the lower limbs after 5 years.
Another one?
This is the wife. In February, he just sits in a wheelchair and moves the arms. He can use them, the upper limbs. Marriage standing. 8 months, about 1 year after the treatment, without no treatment in this period, he had no regression. After 1 year and other 10 sessions of maltreatment, he recovered in fine motor skill, he can eat. So this is a miracle.
We'll pull the banana peel back. Pull it back. And the other peel, the other side, yeah. Good. Now put it in your mouth. Very good.
And this is the publication. First publication in a mess with this treatment, okay, intensive. This is an example. Okay? We have a lot of this situation. After only 5 sessions, this lady was able to hand, and to head. Look, incredible.
I just
incredible. So far.
And I don't have hair on him anymore, which is nice. For the first time in a long time, I can actually touch my head without sort of, I can even shower and wash both hands. So it's nice. So there's more feeling in it. You've noticed difference in my legs too. The coverage better in my left leg. It's still a little different, but it's a lot better.
And then what about the circumference? Because it was definitely more swollen.
Oh, it was more swollen, it is definitely down, both were swollen, this is definitely down. So I'm noticing in both legs.
Another case, after, this is a case, not the research, not the dates, are only case, but at the end I show you this. 3 months after, only 9 sessions, okay, Iran, incredible, 9 sessions of month. This is the conclusion. If we have in 40 patients with progressive MS, from 6 to 9, after only the first cycle, not 15 sessions, not only 10 sessions of intensive MAM treatment, we had the following results. What does it mean? That is not a miracle, but this is a therapy. We published this. Okay? These are the results. 7 scientific questionnaires approved before and after treatment of these 40 patients. What was the results? Improvement after 10 sessions. The score was 83% of the improvement. And of this, the 15 fell in physiological value. The second miracle. You know what is alternative hemiplegia of childhood? After cerebral lymphatic drainage, we had this disease is a rare neurological disorder. 1,000 only in worldwide. This is not labeled, but the very important is that they have dystonic crisis with pain from 2 years to the death. The number after 1 hour of treatment with the Actimum, we had these results. The treatment session every 2 weeks, a month. Look, hemiplegic episodes decreased from 21 to 10, more than 50% of reduction. This is very important. Dystonic crisis, the pain dropped from 37 to 7, 8% of reduction. This is another miracle at the moment. When we treat 10 of this, in Italy we have only 50. When we have possibility to treat 10, we can do this is the treatment, the therapy also for this disease. Hey, it happened perhaps in the future, together we can. I thank you for your attention and listen from my beloved